Southern Vermont AHEC Let's Talk podcast. I'm your host, Peg Bolgioni, and today we're celebrating an important milestone in Vermont's healthcare workforce, the 30th anniversary of the Vermont Area Health Education Center Network, better known as the Vermont AHEC Network. For 3 decades, the Vermont AHEC Network has worked to strengthen the state's healthcare workforce by connecting students, educators, and communities, especially in rural and underserved areas. From introducing young students to careers in health, to supporting clinical training and professional development, AHEC programs help build the pipeline of healthcare professionals that Vermont communities rely on. Our conversation also comes as we approach National AHEC Week, which is March 23rd through the 27th, when programs across the country highlight the important role AHECs play in preparing the next generation of healthcare providers. Today, we're joined by 2 leaders who have been deeply involved in that work. First, Dr. Mimi Reardon, Emerita Clinical Professor of Medicine at Robert Larner College of Medicine at the University of Vermont, and their Associate Dean of Primary Care in AHEC from 1993 to 2006. Dr. Reardon has been closely connected to the Vermont AHEC Network and its growth over the years. And we also have Dr. Ann Morris, current Associate Dean of Primary Care and AHEC from the Robert Larner College of Medicine at the University of Vermont, whose work focuses on strengthening medical education and training across the state. Together, we'll look back at how the Vermont AHEC Network began, explore how it supports the healthcare workforce pipeline today, and talk about what the future might hold for training the next generation of healthcare professionals in Vermont. So let's get started. Dr. Morris and Dr. Reardon, I am so pleased to have you both on my program today.
Thank you. It's good to be here.
And so we'll just
having us.
We'll just dive right into the questions. So, Dr. Reardon, this is really to you. As the Vermont AHEC Network celebrates its 30th anniversary, can you take us back to the early days of what inspired the creation of the Vermont AHEC Network and what healthcare challenges in Vermont made it clear that something like AHEC was needed?
Well, 30 years ago, I can't believe 1996, the University of Vermont College of Medicine received word that Vermont's application to HRSA was successful, and we would receive federal funding and funding support to establish Vermont's AHEC program. I do remember the day, and I do remember the joy, and I do remember the trepidation, because now we had to get the work done. The seeds for that day were planted 3 years before that. In 1993, a growing healthcare workforce shortage with statewide, national, and global components was very evident. The Vermont legislature discussed this concern with the then dean of the College of Medicine, who decided to establish the position of Associate Dean for Primary Care and tasked that office to establish a plan of action for healthcare workforce development in Vermont. The dean asked me, at that time a full-time clinician in general internal medicine at Escalapius Medical Center in South Burlington, to serve as the first Associate Dean for Primary Care and to concentrate on Vermont's healthcare workforce shortage. With time and effort from many individuals, an outline for a statewide AHEC program for Vermont was then visualized. This was in 93 and 94. We were beginning to set up that vision. It involved input from state government, from the Vermont legislature, from the College of Medicine, from the 14 hospitals in Vermont, from community leaders around the state, from Vermont's congressional delegation, the Department of Health, the Medical Society, and physicians and clinicians and community members statewide. We applied to HRSA in 1994. We were not funded. We applied to HRSA in 1995, and again, were not funded. We were finally successful in 1996. Our sole mission was then, and I believe is now, healthcare workforce development, and to accomplish this through a continuum beginning in middle school and continuing all the way through the working professional.
Well, this is quite a compelling story. Was Howard Dean governor at that time?
It's a good question. I can't remember if it was Howard or I think it was Howard, yes.
Okay.
The congressional delegation we worked with much more closely, so I do remember them very closely. And I think it was Howard Dean, but I'm not 100% sure.
Yeah. No, that's all right. I was just thinking, I used to work for Senator Jim Jeffords. So
he was involved.
Yeah. I'm not surprised.
Yeah.
So Vermont is often known for innovative community health initiatives. And what made Vermont, in your opinion, a strong place to establish the AHEC model? And how did the state help shape what the program became?
Well, our small geographic size and our collegial access to leaders in the legislature, in state government, in academia, and in healthcare settings around the state contributed to allow us to have a collaborative environment and a strong place to establish and support an AHEC model. So I think then and now an effective AHEC network truly requires that we're all in it together kind of philosophy and action plan. And we recognize the need throughout the state, and we wanted to work positively together to try to meet the needs that were there.
Yeah. Well, and I think that's the advantage of having a small state like Vermont, because I think that most of these individuals, legislators, congressional delegation are much more accessible in the planning of something like this.
Yes, very much so.
Yeah. So
I mean, hospitals and the individuals within the legislature, the health department. I mean, it was relatively easy to get these people together to try to put into place that actual network that we needed to have a reasonable application to bring to HRSA, and to let them know that we had broad support to accomplish what we were so much in need of trying to accomplish.
Yeah. And Dr. Morris, from the perspective of the Robert Larner College of Medicine at UVM, how has the Vermont AHEC Network strengthened training opportunities for medical students, particularly in rural and underserved communities?
Well, I think that the AHEC network really serves to be a bridge into our communities. So from the classroom out into our communities. The network continues to play an important role in the medical school training. All students complete a core clerkship in family medicine. And during this rotation, some of the students are placed in rural clinics, which help to expose them to our amazing rural communities. All students also participate in a community project during that time that's facilitated in part by our AHEC team, and really helps our clerkship students understand what it's like to live and practice medicine in rural and underserved communities in Vermont. Additionally, all Larner College of Medicine students can participate in our AHEC Scholars Program, which is a nationally recognized extracurricular program with the goal of increasing students' understanding of really the societal and cultural factors that influence an individual's overall health, as well as their ability to access care. And so students can participate in many things that really help to demonstrate holistic and community medicine, including public health projects, community engagement and service with our local community partners. And in the fourth year, they get to have additional electives such as addiction medicine, our LGBTQ health elective, and our community engagement and social medicine elective.
All right. Well, looking at the present day, how does the Vermont AHEC Network support the health workforce pipeline from K through 12 exploration to professional training? And what impact are you seeing across the state? And this question is actually to both of you. So, Dr. Morris, did you want to respond to that?
Of course. We know that those who live, learn, train, and experience rural communities are more likely to work in rural communities in the future. And our early pipeline programs are really how we grow our own healthcare workforce. It's one of the places that I think the AHEC network really shines across the state. In the last 5 years, we've worked with over 46 schools, and more than 76% of them have been in rural counties. In the last 10 years, we've sponsored over 49, almost 50 pipeline programs and interacted with over 1,000 individual students through classroom programs, health fairs, internships, mentorships, and experiential residential programs, all designed to expose students to get them excited about careers in healthcare.
Dr. Reardon, did you want to comment on this?
I mean, I think what Dr. Morris has related sounds great. I mean, she's with it currently. It's been a while since I've been directly involved with this. And I think that what's described about the student involvement in the communities is key, and encouraging their involvement to become the healthcare workforce in these communities is key. And all of these things that Dr. Morris has been mentioning support that possibility to happen. So that's great.
I think I would add that many of our programs allow our current medical students to act as peer or near peer mentors to high school students and to undergraduate students. And that experience of being able to share what it was like for them to discover careers in healthcare, sometimes I think that impact is very hard to measure, but immensely positive.
No, I don't. I definitely agree with you. I know that when we do our MedQuest camps in the summer and we have students from the Larner College of Medicine come down and act as mentors, it's been enormously successful. The students are so interested in what the medical students have to say and are even inspired by them. They do a phenomenal job.
And they really get to see things that they might not otherwise see within their own local middle schools and high schools.
Exactly. No, I agree. And these pipeline programs are so essential. And it's been so gratifying that number one, they've been around for so long and they're still continuing and growing and thriving. And it's so satisfying to see the students just get excited about the possibilities in the healthcare world. And with National AHEC Week coming up next week, the 23rd through the 27th, organizations around the country are highlighting their work. And so, what does this mean for Vermont's AHEC network, and how does Vermont connect to the broader national AHEC movement? Dr. Morris, did you want to take this question?
National AHEC Week is really an opportunity for us to shout from the rooftops that across the nation, AHEC networks, just like Vermont's, are developing and sustaining our nation's primary care workforce. I think it's an opportunity for us to show that we're all working towards the same goal. At a time when our healthcare systems are under immense pressure to reduce costs and improve outcomes, investing in primary care really is the solution. And we have the same goal to build and support the healthcare career infrastructure to maintain that high quality care access, including to those in our most rural and underserved communities. I think what's unique about each individual AHEC, including, the program office at UVM, as well as our Southern Vermont AHEC and our Northern Vermont AHEC offices, is that they get to provide individualized programming at the county level that best suits the individual healthcare needs of each of the communities. So it's what's so unique about our AHEC programs is that we get to really individualize them to our local communities.
No, you're absolutely right. Dr. Reardon, did you have anything to add to that?
Well, the only thing I would add is that when we were struggling to start an AHEC program in Vermont, the some other states were really very helpful. And I particularly remember going over to visit the main AHEC program and having their program director come over here, and we found that to be extremely helpful. So I just wanted to add that, our individual programs can help in many ways for other programs as well. And I was appreciative at that time for that kind of assistance.
Well, I mean, collaboration is key to the success of any program, but I really feel that I think you're absolutely right. We all work together and we're all working towards the same goal. We need to build this health workforce, not just in Vermont, but across the country. Can either of you share a story or an example of a student or healthcare professional whose path was shaped by AHEC programs in Vermont?
Well, I'll take a stab at this. This is Mimi, but I I remember when we started to get a number of these programs established, the wonderful feeling that I had when I began to see students that had been, or I should say professionals, who actually had been involved in the MedQuest program. Do you still have that?
Oh,
The
yes.
MedQuest program in the communities, and actually apply to UVM, come here, some of whom became part of the PEP program, the pre-medical enhancement program, and then came to the College of Medicine, and then actually went out on rural rotations and enjoyed being in the Northeast Kingdom, and actually took residency and then started to practice there. And when you see something like that, it's like, wow, this really does work. So I have that memory. I also have a memory of a specific, I mean, some names I don't remember, but this one I do. Dr. Mary Reedy, who practices in the Northeast Kingdom. And Mary, I remember her at Vermont Recruitment Day. She was quite interested in trying to find what a place that she and her family would enjoy living, and she would feel as if she was needed, and the skills that she had been acquiring were truly needed and made a big difference in the community. She went to the Northeast Kingdom, and that's got to be over 20 years ago, and she's still in practice up there. So those kinds of things kind of warm your heart when you feel them.
No, I agree. We do a lot of tracking of our former MedQuest students and C-SHIP students, which is our internship program, and it's fascinating to watch their trajectory, their career pathway, and how it evolves. And many of them, as you had indicated, they come full circle. They go through the programs, then they go to medical school, then they come back and they practice in Vermont. And that's what we need. And that's why AHECs are so important. Dr. Morris, did you have anything you wanted to add to that?
Oh, absolutely. I actually think this is my favorite question because seeing families, physicians around me benefit from the AHEC programs, as well as wanting to support our current primary care workforce into the future, were both major drivers leading me to my current role as the Associate Dean for Primary Care. And working at Milton Family Practice and then as the program director for the UVM Family Medicine residency, I've repeatedly seen how AHEC is shaping Vermont's primary care workforce. And Mimi actually took the words out of my mouth, the example out of my mouth. My office mate is an AHEC lifer. They started with the PEP program at UVM as an undergraduate student, went to UVM Medical School, participated in our AHEC mentoring and our summer projects, went to UVM Family Medicine residency, participated in AHEC-supported rural rotations in the Northeast Kingdom, and now is a practicing family physician and has been a PEP faculty member for years. And today, literally, as I was getting permission to use this office to have this conversation, this physician actually brought a current PEP student in to introduce to me who is shadowing in our office today. So just perfect timing for our conversation. But beyond that, I really, truly have seen the benefit of our educational loan repayment programs, as well as the AHEC Scholars Incentive Loan Forgiveness Program, benefit those who are going into specifically family medicine currently, because that's where I practice. About 50% of our UVM Family Medicine residency graduates stay in Vermont every year when they graduate. And every year, graduates apply for and are awarded educational loan repayment awards to help pay down their primary care and medical school debt. Similarly, we have 2 residents currently who have been recipients of the AHEC scholarship, and will take employment or seek employment outside of Chittenden County after they finish their residency. So we know that these programs are working. We know that they are attracting family medicine physicians to stay in Vermont. And I can't tell you how proud it makes me to be able to say that I've had an opportunity to help train these physicians, because I think part of what Vermont needs are not just physicians and clinicians in general, including APPs and nurse practitioners and physician's assistants who can really become members of their community, but they also have to be able to provide broad spectrum care so that they can give their patients the best care in the location, in their communities, and not have to have them travel far away. One of my residents told me, as a native Vermonter, I want to be able to give back to the community that helped shape me. The AHEC Scholarship has allowed me to better afford my medical education and fulfill my goal of building my medical career here in Vermont. And I think it's just, it's so important that we acknowledge that there are young physicians who want to be part of our communities and want to provide really amazing primary care to our patients.
Well, you said it brilliantly, Dr. Morris, and thank you, both of you, for those comments. As healthcare needs evolve, especially in rural states like Vermont, what opportunities or challenges do you see ahead, and what role the Vermont AHEC Network would play in preparing for the next generation of healthcare professionals? Dr. Reardon, did you want to start?
Well, it is essential to recognize that AHIC can continue its role only if there is funding to support AHIC programs. AHIC statewide core funding comes from federal, state, and hospital grants, basically. in recent years, I know there's been significant changes in the grant funding environment. And I do think for an effective and sustainable AHEC to benefit all Vermonters for future generations, it would be wise for AHEC to consider expanding its fund development to include cultivating private donations and benefactors. And I think when I'm thinking of this, I think of in the past a family that made a huge difference for us um, shortly after we started the program, and that was the Freeman family and the establishment of the Freeman Medical Scholars and the Freeman Educational Loan Repayment. And I mean, I don't have any families like that in mind, but I think that it would be, and I know that this is a kind of an, it's a, uh, it's a, it's a topic that has to be carefully considered. But I think that our AHEC's relying totally on federal, state, and hospital funding may not be the wisest thing for the future. We may need to be thinking for our future to continue of trying to figure out ways to expand that into private benefactors and private donations. Just
All right.
a thought for the future.
No, that's a very important thought, and I appreciate you sharing that. Dr. Morris, did you want to comment on that?
Oh, I think that Dr. Reardon has hit the nail on the head that it's incredibly difficult to finance our healthcare system. I think that there is a lot of effort being put into reforming our healthcare system and trying to reduce costs. We know that investing in primary care reduces those total healthcare costs, and we know that it improves the healthcare outcomes for patients and their families. The tricky part is that you can't only look at the payment system and how healthcare gets paid for. You also have to consider those who are delivering the care. And the really important role I think that AHEC provides is that other side of the fork where we are the ones that are helping to develop and train and sustain the primary care workforce. And that definitely means that we are going to have to continue to be innovative and creative to ensure that all of Vermonters have access to high quality healthcare. I think we are so special to be the longitudinal support throughout, the entire life cycle of many healthcare providers' careers. We get to make the long-term investment in supporting our primary care workforce, and eventually that will pay off for Vermonters in the end.
All right. Well, this was a wonderful conversation. And again, I am so appreciative that both of you were able to join us today. And that actually brings us to the end of the conversation. As we've heard, the Vermont AHEC Network has spent the past 30 years helping connect education, community, and healthcare, supporting students, training providers, and strengthening the healthcare workforce across the state. As Vermont continues to face evolving healthcare needs, especially in rural communities, the partnerships and programs built through AHEC remain an important part of preparing the next generation of healthcare professionals. A special thank you to Dr. Mimi Reardon and Dr. Ann Morris for sharing their insights and experiences with us today. And as National AHEC Week, March 23rd through the 27th approaches, it's a great time to recognize the impact of AHEC programs, not only here in Vermont, but across the country. So we thank you for listening, and we hope that you'll join us next time on our Let's Talk podcast. Take care.
Thank you.
Thank you.